Are you making every effort to reduce your creatinine levels but failing to see any progress? You might find the solution in the veggie drawer in your kitchen. Unbelievably, some vegetables can help lower those stubborn creatinine levels, assist detoxification, reduce inflammation, and preserve your kidneys. Here's the catch though, not all vegetables are created equal. What exactly should you consume then to support your kidneys when they need it most? This video reveals the 5 most potent veggies that are not only kidney safe, but also actively work to lower creatinine. You'll discover how each one functions within your body, which nutrients are most important, how to cook them properly to preserve their kidney-boosting properties, and even the one typical error that could be preventing you from getting the results you want. Let's begin by discussing one of the most underappreciated kidney-healing veggies that is actually quite visible: onions. Despite their apparent simplicity, these unassuming bulbs are a great source of antioxidants that can help decrease creatinine and provide your kidneys with the comfort they require. This is how it operates. Quercetin, a strong antioxidant found in onions, helps lower oxidative stress and inflammation, 2 main causes of kidney disease that can hasten kidney deterioration and increase creatinine levels. Your kidneys have a higher chance of functioning correctly when there is less inflammation, since it puts less strain on them. Please let me know where you're coming from today before we begin. Feel free to ask any questions you may have and leave a comment below. Remember to click the subscribe button and enable notifications so you don't miss any of Seniorhealth's top health advice. Additionally, onions strengthen your body's antioxidant defense, which benefits kidney function in general. They are full of vital nutrients that your kidneys need, such as iron, folic acid, and vitamins A, B6, C, and E. Approximately 14% of your daily vitamin C requirements, as well as about 167 milligrams mg of potassium and 29 milligrams of phosphorus, can be found in 1 cup of sliced onions. These amounts are low enough to be included in a kidney-friendly diet. In addition to aiding in the elimination of toxins, the fiber in raw onions may eventually lower creatinine levels. Onions do more than that, though, particularly if you have diabetes or high blood pressure. By naturally reducing blood pressure and enhancing insulin sensitivity, they aid in the management of these 2 significant concerns associated with renal disease. Now you have even more justification to incorporate them into your favorite dishes. Nowadays, the majority of people already like using onions in their food. However, the way you cook onions makes a huge impact when your kidneys require additional attention. Follow these explicit do's and don'ts to keep onions kidney-friendly so you can reap their benefits without risk. Whenever possible, eat onions raw. This gives you the most quercetin and sulfur compounds, which are excellent for lowering inflammation and enhancing insulin function. Pick either yellow or red onions. Compared to white ones, they have more antioxidants. In particular, yellow onions might contain up to 11 times as many antioxidants. Add garlic and herbs to olive oil and sauté the onions. This enhances flavor without adding excessive amounts of salt or bad fats. What you should not do is as follows: avoid frying onions. In addition to adding calories and bad fats, frying eliminates a lot of the nutrients that make onions nutritious. Don't oversalt foods that contain onions. Excessive salt can increase blood pressure and exacerbate renal disease. Avoid eating too many onions. Despite their great health benefits, too much of them might cause bloating, gas, or bad breath. A few tablespoons of chopped raw onion per meal is sufficient for most people to reap the advantages without experiencing any pain. Up to 1 cup of sliced onions can be safely consumed each day. This is especially true if the onions are cooked, as this can facilitate digestion. Yes, eating a lot of raw onions can make your breath smell awful. Sulfur chemicals found in onions cause this because they remain in the mouth and can even enter the bloodstream, which can alter your breath when you exhale. Apples, which naturally neutralize sulfur compounds, can help. Chew on fresh herbs like mint or parsley, or drink lots of water after meals to lessen this effect. You can take advantage of the renal benefits of raw onions and maintain fresh breath by brushing your teeth and tongue right after eating them. Garlic, which also promotes kidney health and blood pressure control, can be used with onions to increase their kidney advantages. To improve the absorption of antioxidants, include vegetables high in vitamin C, such as bell peppers or a squeeze of lemon juice. Moving on from the crunchy bite of onions to another potent vegetable that merits equal attention, will elevate your kidney-friendly menu, particularly if you're trying to naturally lower creatinine and safeguard your kidneys. Are you prepared to find out what it is? Let's discuss eggplant. Has eggplant ever been used to raise creatinine levels in your body? Otherwise, it's time to reconsider. This unassuming vegetable may be among the best and most underappreciated options for your kidneys. For those with kidney issues, raw eggplant is a safe and beneficial choice because it contains about 180 kcal of potassium and 19 milliliters of phosphorus per cup. Additionally, it contains vitamin C and B6, which boost immunological and neurological function and reduce inflammation. Manganese can also be found there. Did you know that manganese aids in the breakdown of carbohydrates, lipids, and sugars, as well as the regulation of cholesterol and blood sugar? Consuming adequate manganese strengthens your immune system and promotes bone health in addition to improving kidney function. Additionally, folate from eggplant aids in DNA repair and the production of healthy red blood cells, both of which are critical for those who suffer from weariness and kidney impairment. What's more impressive about eggplant rich in anthocyanins, it lowers the risk of heart attacks and strokes by protecting blood vessels and halting the oxidation of LDL cholesterol. Additionally, it is ideal for stable blood sugar and improved kidney protection due to its fiber and low glycemic index. Let me now demonstrate the best kidney-friendly technique to prepare eggplants, which retains the vegetable's potent nutrients while subtly reducing its potassium content and making it a kidney-healing food. You won't want to miss this dish if you're serious about using food as medicine. Here's what you must do before cooking. Cut off both ends of the eggplant after washing it. The skin is fine to eat, although it may be a little tough for you, so you can peel it off if you'd like. Since eggplant has a naturally bitter flavor, it's a good idea to season it with salt and leave it for half an hour. This keeps the eggplant from absorbing too much oil, which may make it oily and helps bring out the bitterness. Before cooking, make sure to rinse the salt off. Set the oven temperature to 450 degrees Fahrenheit degua. Cut the eggplant in half lengthwise, then in a bowl mix 1 clove of mashed garlic with 1 tablespoons of olive oil. Drizzle the olive oil mixture over the eggplant or brush it evenly onto the eggplant slices. Place 3 fresh thyme sprigs on top of each eggplant, half after bruising 6 sprigs with the back of a knife or pestle to release their aroma. Roast the eggplant halves in the oven for about 45 minutes after placing them cut side up on a baking sheet. When they are soft and just beginning to brown, you'll know they're done. Squeeze fresh lemon juice over each half just before serving and season with black pepper and smoky paprika to taste. While eating a tasty filling lunch, this easy yet delectable recipe is a terrific method to improve kidney health. However, it's crucial to keep in mind that eggplants contain oxalates, which may contribute to kidney stone production in those who already have them. Also, watch how much you eat if you're following a potassium-restricted diet. For optimal renal benefits, limit your intake of eggplant to 1 cup 82 grams or half an eggplant. We've witnessed the potent kidney-supporting effects of eggplants and onions. The adventure doesn't end there, though. There's another vegetable that has significant therapeutic benefits for your kidneys. In addition to giving your dishes a strong flavor, garlic is the next essential. If you're searching for anything that lowers inflammation, regulates blood pressure, and even improves insulin function, this is a good place to start. Perhaps the most potent kidney-friendly vegetable lurking in your cupboard is garlic. Allicin is one of the most significant of its many kidney-supporting components. Allicin, a potent chemical that provides garlic its potent scent, and the majority of its health benefits is created when fresh garlic is chopped, crushed, or chewed. By assisting the kidneys in more effectively eliminating waste, allicin helps lower creatinine levels in patients with renal disease. It functions as a natural anti-inflammatory and antioxidant, preventing additional harm to kidney tissues and lowering oxidative stress, which is frequently high in people with chronic kidney disease. There's more, though. Garlic helps your kidneys eliminate extra water and pollutants like urea and creatinine through urine, since it has mild diuretic qualities. If you have excessive creatinine or fluid retention, that is a big plus. It also aids in lowering excessive blood pressure, a significant cause and consequence of kidney disease, by naturally relaxing blood vessels. Garlic also promotes improved blood sugar regulation, which is essential for diabetics to maintain kidney health. Despite its modest size, a single clove of garlic contains important nutrients. It is totally safe because it only has 4 milligrams of phosphorus and around 12 milligrams of potassium. Additionally, you receive roughly 7% of your daily folate and 9% of your daily vitamin B6. Although these nutrients may not seem like much, they are important for kidney patients because they support the creation of red blood cells, neuron health, and muscular function. Additionally, these little dosages of garlic can build up in significant ways when taken on a daily basis. In terms of nutrition and renal health, different types of garlic have different qualities. Therefore, let's now discuss them. Fresh garlic is one form that is accessible. The gold standard is this. When crushed or chopped, it contains the most allicin and has the strongest kidney protective effects. It can be used in heated soups and stews, crushed raw, into dressings, or sautéed. Then there is dried garlic, which can be in the form of granules or powder, not quite as powerful, but a convenient option. You should stay away from garlic salt because of its high sodium level, and drying garlic may lessen its allicin content. Finally, minced or chopped garlic in oil from a jar is convenient, but renal patients who must limit their salt intake shouldn't eat it because it is frequently treated with preservatives and may include extra sodium, which is the best. Then, fresh garlic, when taken correctly, contains the strongest type of allicin and provides the entire spectrum of nutrients. Would you prefer it cooked or raw? Raw garlic contains the highest amount of allicin, but it also tastes and smells the strongest, and not everyone can handle it. Try this tip if you're cooking it before cooking. Crush or chop the garlic and leave it for 10 minutes. As a result, the allicin can fully develop before the heat begins to break it down. After that, add it to rice dishes, soups, or vegetables after softly sautéing it in olive oil. Are you concerned about garlic breath, though it's completely typical? Sulfur molecules found in garlic might stay in your mouth and even in your blood. Try chewing fresh herbs like mint or parsley immediately after eating to control the stench. Green tea consumption can also aid in the natural neutralization of such substances. Additionally, remember to clean your teeth and tongue for a quick revitalizing treatment. Rinse with a solution of lemon juice and water. 1 to 2 little cloves of fresh garlic per day are thought to be safe and helpful for the majority of persons with chronic renal disease. Don't use more than a 1/4 of a teaspoon of garlic powder per day. Make sure it's salt-free once more. What about adverse reactions? Garlic is typically safe, but some people may have negative reactions, especially if they eat raw garlic. The most frequent problems include moderate stomach distress, gas indigestion, and poor breath. Rarely, excessive dosages can cause blood thinning. Therefore, you should exercise caution if you are on blood thinners or have surgery planned. One of your kitchen's most underappreciated vegetables is up next: cabbage. It's more than just a crunchy salad ingredient or side dish. A nutrient-dense, low-potassium vegetable. Cabbage should be on any menu that promotes renal health. Are you wondering why? Let's get started. First of all, cabbage contains a lot of potent substances known as phytochemicals. It has been demonstrated that these naturally occurring plant compounds can help prevent chronic diseases like cancer and even slow their course. Vitamins K, C, folate, and B6 are also abundant in cabbage. Together, these nutrients support healthy blood vessels, reduce inflammation, and guard against oxidative stress. As a matter of fact, a single cup of chopped cabbage provides 54% of your daily requirements for vitamin C, a nutrient that is known to enhance immunological function, decrease urea, and assist renal filtration. In addition, cabbage has about 151 grams of potassium and 23 milligrams of phosphorus per cup, which makes it a great vegetable for people with renal issues. Here's something even more thrilling. Additionally, studies indicate that the bioactive chemicals in cabbage may help control blood sugar levels and prevent obesity. These are both significant risk factors for the development of renal disease. These days, cabbage comes in a variety of colors, including red, white, green, and even Napa. Red cabbage has more antioxidants than any other, yet they're all healthy. Anthocyanins, which promote heart health and guard against kidney damage, are responsible for the deep purple hue. White and green cabbage are more widely used, have a softer taste, and are nonetheless high in vitamins. Therefore, start with green cabbage if you're new to it. Red cabbage, however, is a good choice if you want an additional antioxidant boost. Look for solid, dense heads with firmly packed leaves when purchasing cabbage. Steer clear of any with slimy outer leaves, mushy patches, or brown stains. When you go home, put your cabbage in the refrigerator's crisper drawer. When stored properly, a whole head can survive up to 2 weeks. Both raw and cooked forms of cabbage have advantages. Vitamin C and enzymes are better preserved in raw cabbage. It can be easier to digest and contain fewer possible goitrogen substances that can disrupt thyroid function in excess if it is cooked slowly. The most effective method, stir-fry sauté or lightly simmer it to maximize the advantages. Alternate between raw and cooked versions throughout the week. Let's now elevate cabbage to a new level with a dish that is both scrumptious and nourishing. Are you prepared to improve kidney health and add some flavor to your meals? This stir-fry is going to become your new favorite, so keep watching. For the stir-fried carrots and cabbage, use half a cup of grated carrot and 1 cup of shredded green or red cabbage for this dish. A squeeze of lemon juice, a pinch of turmeric, a dash of black pepper, and 1 teaspoon of olive oil are also required. You can also include 1 finely chopped clove of garlic if you enjoy its flavor. In a pan, heat the olive oil, add the carrot and cabbage. Once the garlic has turned golden, stir-fry until soft but is still a little crunchy, about 5 minutes. Cook for an additional minute after adding the black pepper and turmeric, then squeeze in the lemon juice. That's it. This is a flavorful, crispy, kidney-friendly, and detox-friendly stir-fry. Half to 1 cup of cooked or raw cabbage per day is a safe and healthy amount for the majority of kidney sufferers. It offers a substantial dosage of preventive nutrients and maintains potassium levels at 150 milligrams or less per cup. After making that healthy cabbage recipe, are you still unsure of how to incorporate more kidney-friendly foods into your meals? Green beans are here to provide exactly what you require. This veggie can help decrease creatinine levels and assist your kidneys. Let's explore and learn about its amazing advantages. Their capacity to lessen oxidative stress and assist the body's detoxification processes holds the key. Chlorophyll flavonoids and vitamin C antioxidants that help shield kidney cells from harm are abundant in green beans. That's not all, though. Green beans are also beneficial since they contain B vitamins. They supply about 9% of the daily folate need and 5% of the daily B6 requirement. By improving the body's ability to digest proteins, these vitamins lessen the accumulation of waste materials like creatinine. Additionally, green beans offer a small quantity of iron, a mineral necessary for the production of healthy red blood cells, and the avoidance of anemia, which is prevalent in kidney disease patients. Balanced iron levels increase oxygen transport to the kidneys, lowering renal stress and delaying the onset of need. That's not all, though. You may be surprised by the amount of potassium and phosphorus. 1 cup of green beans contains about 209 millimoles of potassium and 38 millimoles of phosphorus accordingly. Eating 1 cup or even half a cup of green beans per day will be sufficient to promote renal function and lower creatinine. Did you know that people with diabetes can benefit greatly from eating green beans? They assist in maintaining stable blood sugar levels and avoid spikes because of their low glycemic index of about 32. They are also a great choice when combined with other carbohydrates because they are high in fiber, which slows the absorption of sugar. Now, picking green beans can be challenging. Select firm, snappy green beans that are fresh. Avoid ones that are spotted or limp. To facilitate digestion, always wash them well, cut off the ends, and think about slicing them into bite-sized pieces. Make sure the frozen green beans you purchase are plain, that is without any flavors, sauces, or salt added. Avoid the canned ones since they frequently include a lot of added sodium, which can cause blood pressure to rise and renal patients' fluid retention to increase. The best technique to prepare green beans is now the question. Green beans can be boiled, sautéed, grilled, or even stir-fried. Try the recipe for steaming green beans with lemon and olive oil. However, if you want to retain the majority of the vitamin C and antioxidants, rinse and trim 1 cup of fresh green beans first. The green beans should be soft but still crisp after 5 to 7 minutes of steaming over boiling water in a steamer basket. Make a simple dressing while the food is steaming by whisking together 1 tablespoon of fresh lemon juice, 1 tablespoon of olive oil, and a teaspoon of sea salt. After the green beans are cooked, pour the lemon dressing over them and move them to a serving bowl. Add fresh parsley rich in antioxidants and a drizzle of extra virgin olive oil, rich in healthy fats for further renal benefits. Savor it with any kidney-friendly cuisine as a side dish. About half to 1 cup of cooked green beans per day is safe for the majority of kidney sufferers. However, if you're worrying about the negative effects of eating green beans, the majority of renal sufferers can safely consume them. Lectins are the sole thing to be aware of when it comes to raw green beans. These are natural proteins that, when consumed in large quantities, raw may cause moderate digestive problems and interfere with the absorption of nutrients. Choose steamed or simply sautéed green beans instead of cooking them raw because cooking deactivates them. The top 5 veggies to reduce creatinine are listed there. But hold on. In addition to being good for your kidneys, there is another vegetable that will help you reduce your creatinine levels even more quickly: cucumber. Let's take a brief look at the crispy cucumber salad, which is one of the simplest and most ideal dishes for cucumbers. You'll need roughly 2 cups of fresh cucumber to create it. Add 2 teaspoons of Caesar or Italian salad dressing to the cucumber slices, then season with freshly ground black pepper to taste. Add the cucumbers and dressing to a medium bowl cover and shake to coat evenly. Toss in the black pepper chill and savor a crisp, refreshing salad. If these suggestions were useful to you, please like this video for more simple kidney health support. Much more is yet to come. Valuable lesson. Incorporating specific vegetables into your diet can be a powerful and natural way to support kidney health and potentially lower creatinine levels. Remember that variety and moderation are key, and preparation methods can significantly impact the nutritional benefits. What are your thoughts? Do you have any go-to kidney-friendly vegetable recipes? Share them in the comments below. Don't forget to subscribe to our channel for more valuable health tips. On a scale of 1 to 10, how helpful did you find this video? Let us know in the comments.